that door closed behind you?
Which door?
Hey, Dave.
In jail.
Oh, yeah.
I'm talking to my clients, so
Oh, yeah.
it's a scary
You go to
thing.
the visit and it's scary.
You did.
Oh, that's what I mean. Well, you know, I
Would you like to borrow mine? You don't write on them. That's the
You know,
official record.
Jim Simone's always saying that people
Need that?
knock my ass up. I'm not talking. I ain't saying nothing. Excuse me, officer. Can I speak with you?
we used to say it there.
In this meeting, I wouldn't even be here today.
Good morning, ladies and gentlemen.
My chest is going.
We're here for the confirmation hearing for the executive appointment of the Director of Health and Human Services. Madam Clerk, will you call the roll?
Mr. Miller,
Present.
Mr. Brady,
Present.
Mr. Germana,
Here.
Mr. Schron,
Here.
Ms. Conwell. Here. Mr.
Here.
Ms. Conley,
Here.
Mr. Rogers. Here. Ms. Simon, is absent at this time, and Mr. Greenspan.
Here.
A quorum is present.
All right, thank you. Welcome, ladies and gentlemen. We are here this morning for consideration of the appointment of Richard Rick Werner as Director of Health and Human Services. As I've done in the previous hearings, I'd like to explain the process Council will follow and summarize the charter provisions under which Council exercises its authority to hold these hearings. For each nominee, we have asked Mr. Fitzgerald to submit a written letter of nomination with the nominee's resume and documentation of the nominee's qualifications as required by the Charter and the revised code. Once Mr. Fitzgerald submits this nomination, the 30-day time frame in which Council must act begins to run. Council received the materials on Mr. Werner on February the 23rd. The hearing will proceed as follows. We will offer time for public comment for those who have signed in. Public comments are limited to 2 minutes. The nominee will be offered an opportunity to address his qualifications, motivation for seeking the position, and outlook and plans for regarding the office. Council members will be offered the opportunity to ask questions of the nominee. We will do so in rounds, allowing each council member to ask 3 questions per round until all questions have been answered. We are starting at about 10 after 10, and we do have a council committee meeting at 1, so if perchance we are not concluded noonish or so, then we'll continue the matter as we have done in the past. Once all questions have been asked and assuming council is ready, we will entertain a motion to recommend that council consent or not consent to the referral of this matter to the entire body for consideration. We're meeting as a committee of the whole today. In order to make a formal vote on confirmation, we have to have it on the agenda and vote at a regular council meeting. Assuming a motion to recommend is sustained, then we will have it on the agenda, as I said, in the meeting of March the 8th. Article 8, Section 801 of the Charter establishes the Department of Health and Human Services, which, and I have a quote, shall administer all programs and activities for which the county has or has assumed responsibility for the protection and enhancement of the health, education, and well-being of county residents that are not assigned by general law elsewhere. The department is also charged with coordinating its activities and cooperating with other boards, agencies, and offices in order to avoid duplication of services. Section 802 sets forth the qualifications of the director. The Health and Human Services Director must have had at least 5 years' experience in upper-level management in either the public or private sector with responsibility for the provisions of human services as provided in Article 8. Section 802 also mandates that Council confirm the Health and Human Services Director's appointments. In addition, Section 801 requires that council provide by ordinance for such deputies and assistants to the Director of Health and Human Services as shall be conducive to the efficient performance of the duties of the Department of Health and Human Services. This specific provision is in addition to the council's responsibility to establish departments. So we will be passing an ordinance when we get recommendations from you as to those deputies. I note that Mr. Werner is here. He's no stranger to the council. He's been working with us, been working very closely with Mr. Brady in terms of our committee. In our short time in office, he has already presented to council several times, so we look forward to hearing from you this morning. Has anyone signed in for public comment?
Madam President, no one has signed in for public
Okay,
comment.
is there anyone here that would like to make a public comment that has not signed in? All right, Mr. Werner, you're on the hot seat. My council persons have been diligently working on questions to ask you. So,
and I've been diligently working on the answers, Madam Chair. Good morning, Madam President and members of council. I appreciate the opportunity to be here, and I hope that I can, in the course of this morning, persuade you of my qualifications to be the Director of Human Services. I want to thank the County Executive for forwarding my name to you, and I will do a short little bit of background about me, talk a little bit about the last 6 or 7 years at the county in terms of the Human Services Department and what we do, and then a little bit about looking forward. And I know we've had the chance already to have a couple of those conversations, and then I'd be happy to entertain as many rounds of questions as you have for me. I did ask Ruth Gillette, who you may recall during the transition briefing of you, who came and sang a song to open up our briefing of you, and she offered to come or make up words for me for Getting to Know You, the song Getting to Know You. I declined to sing that myself, and she is in a meeting and can't get out, so I think we'll just have to start with prose. I am a native of Lakewood, Ohio. I grew up in Lakewood in Councilman Miller's district, went to Lakewood High School, went to Columbia University to get my Bachelor's of Arts in Political Science. Right out of college, I worked for a year for the mayor of Lakewood. At the time, that was Mayor Tony Sinagra, between college and law school. My parents had both been very involved civically in Lakewood, and my dad was a councilman for a short period of time and was also on the Lakewood Planning Commission. So I think I remember getting the calls, or my dad getting the calls at home that I'm sure all of you get, every evening and on the weekends and early in the morning about issues that go on in your district. So I think I got an early introduction to the kinds of challenges that you all face in your respective roles. After graduating from college and working for Mayor Sinagra for a year, I went to law school, and I'm proud, but I say this somewhat quietly. In Ohio, I went to the University of Michigan Law School and graduated, and then went to work for a law firm here in Cleveland, Squire Sanderson Dempsey, who has not offered an opinion on my qualifications for the job that I know of. And after practicing at Squire Sanders for 3 years, I went to work for a firm in Washington, D.C., where I practiced for 3 years. I then took some time off and worked on various political campaigns and ended up in Columbus working for the then Attorney General Lee Fisher, and that was in his political office, not his AG's office. After that, I moved to Cleveland, or returned to Cleveland, because the woman I was dating would not move to Columbus, and went to work for Bank One as the vice president of governmental relations, worked there for a couple of years, and then went to work for Mayor Michael White during his second term. My responsibilities were community-based, working with community activists and organizations, as well as being the mayor's liaison to the Cleveland City Council. So in that regard, I got a chance to get to know council members Brady and Miller at the time. I left the Mayor White's administration at the end of his second term and came to work at the county at that point. That was at the time that the county was just beginning to grapple with the challenge of putting together a response to both the federal and state welfare reform law that went into effect in 1997 and was started to be implemented in the county in 1998. I worked in the department that was challenged with attempting to assist 27,000 families who at that point were on cash assistance and who had a time requirement put on their benefits at that point. And so under the Ohio law, families had 3 years to move off cash assistance. And so I was part of the senior management team for that department. We got through the October 1st, 2000 deadline for folks to move off cash assistance, and I'm pleased to say, and this is really due to the work of the families themselves with whatever assistance the county could provide, many families, in fact, were able to transition from cash assistance to employment. The challenge remained then, and I think remains now, that many of the families moved into relatively low-wage jobs that often did not have benefits, and so the challenge that we've continued to face is how to assist families who maybe have made it up the first rung of the ladder but haven't had the chance to fully move into sort of, if you will, unsubsidized or unassisted employment. I worked at the Department of Work and Training for a couple of years and then came over to work in the Deputy County Administrators for Health and Human Services office doing planning and implementation. I was there through the end of 2002. At that point, Betty Meyer, who was the Deputy County Administrator for Health and Human Services, retired, and Dave Rhines, who was then the County Administrator, asked me if I would step in while they did a search for the Deputy County Administrator. I applied for the position and got it in 2003 and have been in that role ever since then. The Deputy County Administrator under the previous county commissioner form of government was the state-recognized Director of Human Services. They called it Deputy County Administrator because, as you know, there was a county administrator, and all 4 operating departments of the County Human Services Department reported up through the office I was in to the county administrator and the commissioners. During the time that I was Deputy County Administrator, in addition to assisting the department directors and our partners in the community with attempting to move the human services agenda forward, we also worked significantly on the health and human service levies, and I know we've had the opportunity in Mr. Brady's committee to talk a little bit about the health and human service levies. They are obviously the linchpin or the bedrock of the county's ability to provide human services or to provide the social services safety net. We have worked on 5 levies since I took the job as Deputy County Administrator in 2003. I'm pleased to say that with tremendous community support and good organization, as well as leadership from elected officials across the community, including yourselves, we've been able to pass those levies every time. We have a challenging levy that will be on the ballot next year, and part of my plans, should I be confirmed, is to try to plan for the another successful campaign. That is a lot about making sure that the County Human Services Department, both in its partnerships with community-based agencies and providers, but also internally, is efficiently and effectively run. If I might just take a couple more minutes and talk a little bit about the last few years at the county in terms of human services, and then a little bit about the future, and then I'd be happy to answer any questions. One of the things that we've worked on a lot, and I say this in modesty for what the county does, because we've been able to do it with partners in the community, is we've attempted to create continuums of care in a number of areas that make sure that families or individuals who need social services help have the ability to make progress along a continuum of care to the point where they become self-sufficient. That may be in issues of family income or employment. It may be in issues of substance abuse or behavioral health treatment. It may be in the context of having a child involved with the child welfare department or the benefits department. And so we've tried to make sure as the lead public system, we have tried to ensure that there is no aspect of a family's or individual's journey along the way where there is not, to the greatest extent possible, there's not a gap in the kinds of services that they need delivered to them as much as possible in their neighborhoods and as sensitively as we can to their issues, whether that's cultural, language, religious, or any other kind of particular characteristic of that family. In a number of areas, probably starting with the Department of Children and Family Services work on the family-to-family neighborhood collaboratives that was established well before I worked at the county back in the early 1990s. That was a intentional attempt by the Department of Children and Family Services under the Commissioner's leadership to reach out and work more closely with neighborhood-based agencies. Up until that point, the child welfare system was not viewed positively by many folks in the community because the department was thought of as the organization that comes in and takes children from their homes. That isn't, in fact, the case that we must do at certain times, but what the family-to-family collaborative approach was to make alliances, create alliances with neighborhood-based agencies who were trusted by the families that we might need to serve, and to try to work partnerships so that we could assist families before their situations got to such a point where we had to step in and remove children. That family-to-family collaborative approach has really been the hallmark of the Department of Children and Family Services over many years, and in fact has made the Cuyahoga County an anchor site for the Casey Foundation, which is the major national foundation that supports or has supported in the past the family-to-family approach. We have many challenges, as you all know from just reading the paper over the last year or so at the Department of Children and Family Services. But having said that, there's a lot of good work that goes on there with community partners on behalf of the families we serve, and I think it's an important approach that we continue to work on. In other areas, as an example, I will use homeless services as another example of creating a continuum of care. 6 or 8 or 10 years ago, we had emergency shelters, we had transitional housing providers, and we had permanent housing providers, and oftentimes the connections between those important parts of the homelessness continuum were not connected. So folks, men and women, stayed in shelters much longer than they needed to. Under the leadership of Ruth Gillette in the Office of Homeless Services, we have created, I believe, more of a network from emergency shelter to transitional housing to permanent housing. Sometimes that permanent housing takes the form of what's called permanent supportive housing, which is creating communities or buildings within neighborhoods where services can be provided to folks who otherwise can't live on their own because generally they have behavioral health needs which need constant monitoring and constant attention. And so you may be aware of a number of permanent supportive housing sites that have gone up primarily in the city of Cleveland, but now a little bit more into surrounding communities where there's a concentration of folks who are ready to move out of the shelters and have moved out of the shelters but need continued kinds of care. As they get that care, many times they're able to move into permanent housing that they don't need case management, and there are some folks who need to stay in that kind of setting for a much longer period of time. Another area where we've created a continuum of care is in early childhood under the county's Invest in Children program. That was originally started in the around 2001, 2002 as the Early Childhood Initiative, and since then we've been able to bring under the umbrella of early childhood many programs that were oftentimes implemented by organizations within the county, but again, we're not connected as well as they should be. So home visiting programs, early education, the universal pre-K program that the county executive has talked about a great deal during his campaign and since he's taken office. All those kinds of approaches to early childhood were consolidated in our Office of Early Childhood and under the brand name, if you will, Invest in Children. We think that kind of attention to an issue as important as early childhood, which is an economic development issue as well as a human services issue, was a good approach. The Invest in Children model within the county is a good example of another kind of approach that we've taken, which is to try to engage public and private organizations to work together on behalf of an issue that the community cares about. And so I think in early childhood we've been able to do that, and we've gotten significant investment over many, many years from the Cleveland Foundation, the Gunn Foundation, St. Luke's Foundation, Mount Sinai Foundation, United Way, that again, and they have been around the table helping us plan. So I guess another perhaps hallmark of the county's human service approach over the last 10 or 15 years has been to engage with the community and try to open up our planning processes as much as we can to the community and to our partners. There are times, obviously, when we have to sort of shut the door when we're planning an RFP or a contracting process where we can't have folks who may well compete for those contracts around the table. But to the greatest degree possible, we've tried to make sure that as we plan for a new initiative or as we plan for the expansion of an initiative, that everybody is around the table. A more recent example of that is the work on reentry. When the county and the city of Cleveland began to grapple with the serious issue of folks returning to the community from the state criminal justice system, there's no one government that has complete responsibility for that kind of activity. And so the county sat down with United Way, with a number of private nonprofit providers, with the city of Cleveland, and with the foundations to create an approach that blended funding from all those various sources and again try to create a continuum of care throughout the throughout the process of folks returning to the community. Lastly, and there are other examples, I believe, of the continuum of care, but I would also point to you going back to the benefits services. We have tried very much under Joe Gaunter's leadership when he was the director of the Department of Employment and Family Services to make sure that we were part of the continuum that took families from being on public assistance and not working through job training, both soft and hard skill training, working with the workforce development system to try to get folks into gainful employment where they could contribute to society. Oftentimes that meant, though, that we would continue to need to provide them with benefits that perhaps they didn't get through their employment. So health insurance through the Medicaid program or food stamps or child care assistance continue to be provided by the department. Lastly, what I would say about the last couple of years is that we have tried to become more and more evaluation and outcome-oriented. I'm encouraged, as part of the county's Human Service Department, to hear the significant discussions within the county executive's office and within county council about looking at outcomes, not just process elements, but actual outcomes. I think that is something that you need to challenge the Human Services Department to continue to do. But I will say over the last 3 or 4 years, we have tried to focus much more on not just counting the number of people we've provided and the amount of benefits that we provided them and the amount of services, but what is the net effect of those services? Do people advance as a result in whatever particular part of the human services world they may find themselves in? Do they get closer to the goal that they have set for themselves, or that we as their benefits manager, if you will, have set with them? And I think we've got a long way to go to do evaluation planning very well, but I think we've really tried to give it a very significant look, and we hope with your support to be able to continue that. Just a couple things looking forward, and then I'd be happy to answer questions. I sort of thought about this over the last couple of days as looking at it through the probably overused but useful SWOT analysis. So let me take you through just a couple of what I think are the major strengths, weaknesses, opportunities, and threats that we have, and then I'll answer questions. And this is, again, for the Human Services Department. On the strengths, we have a new county government that is focused on transparency and outcomes, and I think that's a very significant support for us to make sure that what we're doing is known to the community, involves the community in the planning for it, and also involves the community on measuring the outcomes. I'm encouraged that County Executive Ed Fitzgerald's County Stat program will be a significant contributor to us within the Human Services Department being able to focus on the most necessary pieces of outcome analysis, both internal and external, meaning internal measurements as well as how we're doing with the organization or the families or the individuals that we're serving. That's an important piece of the leadership that you're bringing to the table, and it's a strength for us going forward. The second piece is the second strength that I think the community as a whole has, which plays itself out in the human services world, is we have a caring community. If you need no other evidence than the fact that every other year, after every other year, the community passes health and human service levies. And I think it's particularly significant, and I think I said this at Councilman Brady's committee a couple of weeks ago, that just 6 months after the Cuyahoga County voters voted overwhelmingly to change the form of county government, and to usher in the county executive and the county council model, they passed a health and human service levy with 66% of the vote. That indicates to me that the voters, the property tax payers in Cuyahoga County, distinguish between the important aspects of what the county does as a health and human service government and what it's like structurally. And they can decide that they want to change the structure. But I think the message that they were sending all of us, both the new government as well as those of us who still work at the county, is that they care that we continue to be able to provide the kind of social safety net that the communities come to rely on. The last strength that I would highlight is just we have strong county community partnerships that exist in the neighborhoods that we work in, that exists with other systems that we work with, like the Adams Board, Metro Health, the Developmental Disabilities Board, the Juvenile Court. We obviously have challenges with those organizations sometimes, and they have challenges with us. I have a feeling Councilman Brady's committee will hear that today from Bill Denahan when he comes over to make a presentation to the Human Services Committee. But even with those differences, and the differences get more difficult in a less resourced environment like we're in now, the fact is there are good partnerships there that make what we do even more successful. On the weaknesses side of the SWOT analysis, we do have old ways of doing business that need updating, freshening up, or sometimes complete discarding or overhauling. And I think some of the questions that I've gotten as I've had a chance to come before the council or Mr. Brady's committee thus far have indicated to me that you understand that there are things that we need to do different or better, and we've certainly heard that as well from the county executive. So I think that we're ready in the Human Services Department to try to meet the challenge of acknowledging that there are things that we need to improve and to try to work with you, your constituents, and the community to overhaul or change the way we approach. I would say one of the other weaknesses, which I guess is also a threat, is just the staffing challenges that we have at the departments. As I think we talked a little bit about it at Councilman Miller's Finance Committee meeting on Monday, we have seen a significant decrease in the number of staff that we have at our basic operating departments that provide the mandated services that we are required to service. So as an example, from 2008 to 2011, the Department of Children and Family Services has gone from 1,041 people to 840. The Department of Employment and Family Services has gone from 942 to 720. The Child Support Enforcement Agency has gone from 438 staff to 355. And finally, the last major service department, the Department of Senior and Adult Services, has gone from 343 staff to 252. I don't say that to say that we aren't going to continue to encounter staffing issues and that those numbers may decline. I guess I'm pointing it out as a challenge to all of us, the county council, the county executive, and us in the Human Services Department, to try to find new ways of doing business that are more efficient, because we're not going to get those staff back. I think we realize that, and I think we also realize that we may even see more declines, and so we very much want your direction and that of the county executive to try to identify ways to and support ways that we identify to operate more efficiently. On the opportunity side, and I guess this is a sort of a mirror image of the strength, the county government, we believe that you and the county executive's office will support new ways of us doing business and will support us in going to seek permission at the state level to change the way we do business. Many of our operations, particularly in those mandated agencies and mandated services, we do not have a choice about how we carry out that business. It is prescribed to us by either the state government or the federal government. We need you and your roles as elected officials, and the county executive has already agreed to help us in a number of ways to take the fight on regulatory relief, if you will, for us to Columbus. Those kinds of that kind of advocacy on our behalf, and your willingness to help us advocate for that will be very important for us to streamline the way we do business. I also think, and maybe this goes hand in hand with that comment, is that the state government, as it cuts budgets, I hope will continue to look at ways to untie our hands locally to provide services. So if they're going to cut the resources that we need or that we have relied upon to conduct business, I'm also hoping that they will cut some of the regulation and the red tape that has caused us to do things in certain inefficient ways that we could probably improve going forward. But again, we need your leadership and that of Ed Fitzgerald to make those cases to the folks in Columbus. The other opportunity that I think is very strong for all of the county government, and I think it's also true for Human Services, is that the civic, business, and philanthropic community want the new government to succeed. So they want Ed Fitzgerald to succeed. They want you and your colleagues on the county council to succeed at improving and streamlining and making more flexible the county government. And we in the Human Services Department want to be partners in that as well. Finally, just on the threat side, and I hate to end negatively, but I guess that's the way the SWOT analysis works, is just, and we talked about this on Monday, is the looming state and potentially later on federal budget cuts. I heard very clearly from Councilman Miller and Councilman Greenspan the need to hurry up our planning on and our implementation for getting ahead of the state budget cuts. We know, as you know, that there will be state budget cuts, and we have to begin to make sure that we're ready to meet those. The other threat that I think we have, and this goes hand in hand with the decrease in staff, is rising demand for services. You know, we are sort of a counter-cyclical agency or set of agencies in the sense that when times get bad, the demand for our services goes up. And so I think we're going to continue to struggle with trying to orient our work and meet the challenges of rising caseloads. We've seen that at every department, I'm afraid, in terms of our direct service departments. Our caseloads are higher than they were 2 years ago, in some cases dramatically higher. Now, I think the directors of the various departments are trying very hard to redeploy resources as best they can to meet that need, but that is going to be a challenge going forward. Finally, how do we respond to the challenges? I think we need to continue to try to manage responsibly with your support and help. Again, I think the County Stat program and the kind of challenges that you give to us on an outcome measurement perspective will help us do that. We need to prepare for the fiscal storm, as I just talked about. We will be looking very closely, as I'm sure you are, and I know the county executive is, at the recommendations that came up during the transition planning process, both from the transition committee that was impaneled by the county commissioners and the former county administrator, as well as the recommendations that came forward from the PFM organization. The PFM recommendations specifically have ideas or recommendations about restructuring and consolidation. I think those are very valid recommendations from having had the chance to look at them and talk with the PFM folks late last year. I'm not sure that the savings is perhaps as significant as they calculate, but in any event, I think we will be forced or required by the coming state budget to look at those recommendations very closely. Finally, for continued priorities, I hope we have the opportunity when we're trying to manage through all of the cuts that we may be forced to make, to continue to try to focus on a prevention model of service. That is, to try to meet families and individuals that need our service earlier on in their potential needs, so that we can, A, get them services earlier, and oftentimes the earlier that we can get them services, the less expensive they are, the less disruptive they are to their families or to themselves. And so I hope we don't lose the ability to become even more prevention focused. Secondly, I hope we can continue to focus on self-sufficiency. And I don't mean that just in the economic sense, although there is an important part of that. There's also making sure that kids in the child welfare system become self-sufficient, and with our assistance, overcome whatever set of challenges their families have to be able to take part in school, graduate from high school, go to college if they have the opportunity. And so self-sufficiency as a guiding priority of ours, I think cuts across all our systems. And then finally, I want to make sure, and I've heard much discussion when I've been at council meetings about the need to focus the county government on economic development. I think human services plays a large role in that, both in two ways. One, the human services community in Cuyahoga County is a large community of providers, both public and private nonprofit, and frankly is an engine to some degree of economic growth. And so I hope we get a seat at the table on that score alone. But the second part of it is also preparing people, being engaged with the Workforce Development Department and the economic development approach of the county so that we can prepare the families and individuals that we serve for the opportunities that your work and the work of the county executive and your partners in the community make possible on economic development. So with that, I will be happy to answer any questions.
Thank you. I also like to commend you for your master's in library science. Having been a non-traditional student working all day and going to graduate school in the evening, it's commendable.
Thank you. If you want an extended offline conversation on the Dewey Decimal System, I will be happy to.
Okay.
I'll be happy to do that. I should say, Madam President, to that end, my one civic obligation or my one commitment outside of my work and my family is I am on the Cleveland Public Library Board of Trustees and have been for the last couple of years.
Right. All right. Mr. Schrein wants to lead off. He does have another engagement. He's going to be leaving us in a few minutes.
Thank you, Madam President. Let's just segue right into economic development. You raised the comments, and we've heard from a number of comments that a lot of our patients' service individuals leave the state because of judicial placements. What would it take to get those placements here? Do we have the facilities? Have we directed them here? And could we do anything to entice this to be an economic development to have those services that are being provided in Pennsylvania and Texas? I understand. Could we entice any of our businesses here to say, okay, if you open this up, we will do everything we can to get the courts to place the candidates into those locations?
Madam President, to Councilman Schran, one thing I know that we owe, I think Mr. Gallagher asked for this a couple of days ago, is just a complete list of where all our kids are, out of state, in state, out of county, in county, and we are in the process of pulling that together. Councilman Schran, as to how we incentivize local providers to provide the kind of services in order to keep children, and this is mainly in the context of child welfare and juvenile justice, as you point out, we have been asked by the county executive and county council to start an RFP process for those large service provider contracts that we brought to you for passage in early February. We are going to attempt to, in that process, very specifically ask for the kinds of services we need, and hopefully that will get a response in the providers that are located in Cuyahoga County. As you all are aware, there are a large number of Cuyahoga County-based children's service providers, Beechbrook, Belfair, Catholic Charities, Berea Children's Home, Cleveland Christian Home, who are very good at providing services and where the bulk of our children who are in residential care are in fact housed. But there is the occasional circumstance where there is not a program or specific response for the needs of an individual child. That's why we unfortunately have to have the need to have some out of county or out of state provider contracts. I'm hoping.
Excuse me, because that service doesn't exist here, or
yes.
It's a better delivered service, or what's the reason why?
Generally speaking, it is because that the particular service for a specific child does not exist here, and our approach has been in any case where there's a judgment call about whether or not a local provider could provide that service through a specific program, we offer the opportunity to that provider to take the child, and there are some cases where a local provider or a set of local providers will pass on serving a child because they don't believe that they're appropriately equipped to deal with the needs of that child. We have some children, and fortunately, it's the numbers are not large, who are very significantly challenging children to take care of when they're teenagers, if they are violent, if they have a history they have a history of being abused, and they probably have a history themselves of committing antisocial acts and sometimes violent acts. And so there are times when the local providers will pass we'll offer it first to one, then to another, and they'll decline the ability to serve the opportunity to serve that child. That's when we look out of state or out of county. Again, I don't think. I mean, I hope when we pull together the numbers for Councilman Gallagher's request, I don't think that the proportion is that high. The unfortunate part is that for many of the children who do go out of state or out of county, they're in very expensive placements because the service is so intensive. And we need to continue to work with our providers to try to build the capacity to serve those kinds of kids. And we also have to do a partnership with the juvenile court so that when those services exist locally, assuming that we can get them established, that the juvenile court's aware of them so they're not ordering kids into a out-of-county or out-of-state placement.
So there would be potentially an economic opportunity if you can convince the right folks to actually put that service in place.
I believe so.
Okay. And then, Madam President, just one more. You indicated in your opportunities, which I'm not sure, regulatory relief is an opportunity as much as it's also a constraint and a threat and everything else. You can probably bundle it into all 3 or 4 of them. Have you actually specifically delineated what those regulatory relief requests are going to be, or have you already been bringing these down to Columbus? And have you been unsatisfactory in getting those addressed?
I want to be. I don't want to say they have not been addressed or considered by the state government. This goes back also to the Strickland administration. Joe Gautner has been very involved at the state level with trying to ease the kind of restrictions so that we can provide telephone redeterminations for people on benefits. Or mail-in kinds of opportunities, so we can reduce the number of encounters that our staff have to have with individual clients. So I don't have a list with me, but we can certainly get you a set of the kinds of regulatory relief that we've been asking for. And again, I want to say that the state hasn't stiff-armed us either under Governor Strickland or under Governor Kasich. It's just we as staff, we don't have the same ability as you as elected officials and the county executive to make the case to the state that kind of relief would be useful to us.
And as a follow-up, that's specifically why the Intergovernmental Relations would like to have them down by listing so we know what it is that we can bring forward. And then even better yet, if we can attach a dollar value to that request as to what it would mean. My understanding is the current administration wants to reduce regulations, so let's put them to the test.
Okay.
Let's call it out. Let's identify what they are. Let's take them down as government relations and say this is the impact it can have on the largest county, and let's translate it into dollars and cents.
We'd be happy to get that to the committee. Thank you.
Gallagher, did we note Ms. Simon's appearance for the record?
Mr. Warner, congratulations on your recommendation.
Thank you.
The thing that I think we're all finding as we move forward slowly and is that we have situations where we have organizations within the county, and I'll name a few like Juvenile Court, Metro, the Adams Board, and others seemingly have built these walls up. And I'm looking at the Health and Human Services Director as an individual that's going to be prominent and moving forward and being really the face of the new county as far as we move forward with social services. Do you see that as the problem that I see that? Because you did mention, this afternoon we'll see Mr. Denahan, and I'll be honest, it seems as though there seems to be a turf war, kind of a struggle. We are this and you are that, and quite honestly, we're all one. If I'm in their shoes, I get it, but if I'm in the taxpayer's shoes, I don't get it. Mm-hmm. And the taxpayers run this county, so that I think they want this to be brought together almost under one umbrella. Do you see it that way?
Madam President, Councilman Gallagher, I do agree with your assessment that there are still silos. I mean, I think a lot of work has gone on in individual initiatives to try to break down some of those silos over a lot of years, but there's still, a sort of a bureaucratic county government on human services. There's still the Adams Board, separate Metro, even though you as a council and the county executive have a lot of influence and almost control, if you want to think about it, both on board appointments to both of those organizations, as well as your decisions for the 2012 budget about the levy investment in those organizations. I do think there needs to be much more work on the stripping away of the walls between these systems. I'm happy to bring my hammer to that process. But I also think that part of the challenge for these individual organizations or systems is that their money comes down from above us. So if you think about the state and the federal government, it comes down in dedicated buckets to those organizations. And so while you have the ability in the county executive to target your use of the dollars that you send to them through the budget process of the Health and Human Service levy dollars, they're also getting their own dedicated dollars that they have the ability to spend. It's really, I think it's getting at the use of those dollars, because those are the ones that are supplemented by the Health and Human Service levy dollars to allow them to provide services. And it's really trying to align priorities and goals for their systems and their use of the other resources they have that I think can break down those walls even more. I don't know where I come out on the issue of whether the entire public human service world should be under a single government banner. I think there would be some arguments for that, but I think in the short term, until the state changes the way that that's structured, and I don't think we have the ability locally to do that, I think we have to continue to work the relationships that we have with those organizations. I think one of the strengths that we have right now, both at the county and within those systems, is that you have seasoned leadership in place who know the value of collaboration. Although I'm sure Bill Denahan will come and will point out differences that he and his system may have with the county, the fact is we work very closely together with him on homeless services, child welfare, reentry, on a whole list of issues that on a day-to-day basis our staff is working very closely with their staff. So how to get that up to the point where the director recognizes that on a day-to-day, on an ongoing basis, and in this case, his board recognizes that, I think it's important. One other thing that I would just say, Mr. Gallagher, to your question, and I think it's something that we need to work on going forward, and we didn't do as good a job of this prior to this year as we should have. When the county executive nominates somebody, or you nominate somebody to one of the boards of Metro Health, as an example, or the Adams board, I know we tried and never really succeeded very well in trying to make sure that the commissioners' appointments to those boards under the old county government were aware of the county situation. These board members would go over and sort of, if you will, get captured by the board on which they sit, which is completely understandable. But I don't think we always did a good job on our side in terms of keeping them educated about the challenges that the county had, which obviously affect the particular system that they help oversee. So I think, again, your leadership and that of the county executive can keep reminding your appointments to these boards that they have to be paying as much attention to breaking down the barriers that you just mentioned as building them up again. And I think, if there's that kind of direction from the board, I have every confidence that the staff in those organizations will follow that lead.
All right, thank you. Ms. Conwell?
Good morning, Rick.
Morning.
Madam Chair, to Rick Warner, I have about 3 questions, or a few more, but I'll break. According to the organizational chart that you gave us in Health and Human Service Committee, the director of HHS reports to the county exec, but past practices for the county in relation to the HHS allow directors to make judgment calls. Have you and the county exec discussed any of the parameters of how this will be handled in the future?
Madam President, to Councilwoman Conwell, we have had some conversations. We are in the process of filling the director's positions in the operating departments. And so obviously your question is very germane to our ability to identify the right kind of leadership that the county executive will feel comfortable with. Under the county commissioners, the directors had a wide latitude within their own systems to make recommendations and to make decisions. And I think a hallmark of the previous administration with respect to those departments, and that I anticipate and will do my best to try to enforce is a good communication process. I mean, there are. I don't think the county executive or the county council necessarily wants to be in the weeds and in the bushes making operational decisions for individual departments when there are people within those departments who have experience and expertise to do that. But there are many, many policy issues and, frankly, contract approvals and other kinds of things that do require communication up to the county executive and ultimately over to county council. So the discussions that I've had with County Executive Fitzgerald have been about identifying folks who are good at running their departments and have experience doing that, and also have that leadership ability to recognize when a decision requires greater input from the elected officials above him or her. And it's my job, if I'm the county human service director, to make sure that those kinds of communications between the county executive and those departments is effective, efficient, gets questions answered quickly. Having worked in a department when I was working for the commissioners, I knew at times there was frustration because it would take a while sometimes to get an answer. I need to be very clear that the Fitzgerald administration has given us quick answers to questions when we've needed them, and I anticipate if we have that kind of effective response going forward, the directors will have the kind of support they need to make the bigger policy decisions, but will also have the authority and autonomy to make those decisions within their organizations that are best made within those organizations.
Second question, when seeking placement outside the county, what would be your top 2 reasons that that the county would choose outside versus within the Cuyahoga County?
Madam President, to Councilwoman Conwell, I mean, overall, no matter where we place a kid, and I guess it goes without saying, we are trying to place a child in an environment that most meets the challenges that the child has. But I will say that the decision to place a child outside of Cuyahoga County or outside of the state is entirely based on our judgment as to the best placement for that child. If there is not a program or a service or a provider within Cuyahoga County who can adequately deal with that child's needs, we would not be responsible if we placed a child locally. One of the things, though, that we work on, and this is true within any provider where we place a child, is that we try to, and this is a great credit to both Jim McCafferty and Deb Forkas, the 2 most recent directors of Children and Family Services. They've worked hard at reducing the length of stay in residential settings, and in the belief that it is better to have a child at home in their community, going to school, going to church, involved with their family, than having them in a very long-term residential setting. So the decision on sending a child out of state or out of county is made purely on the needs of the child. And again, as I indicated in my response to Councilman Schron, we first offer the opportunity to serve a child to our in-county providers, and if they can't, then we are sometimes forced to go outside.
I have some more questions on that one later. Number 3, state budget cuts will be out in a week and a half, which will impact Cuyahoga County. Have you, in your present role as director of HHS, given any thought to how departments could make more efficiencies within each department?
Madam President, to Councilwoman Conwell, we have each department has begun to work on a sort of a contingency plan, and this was the subject of some conversation at the Finance Committee meeting on Monday. I think the good news, generally speaking, and I don't know if it's good from the department's perspective, but it is from the budget standpoint, is that we have many unfilled positions in a number of the health and human service agencies right now. I think if my memory is correct, that there are almost 41 funded but unfilled vacancies right now at the Department of Children and Family Services. At Employment and Family Services, I think it's upwards of 20. That in the short term means we're saving money, because money that we budgeted for those staff is not currently being used. There is a service cost to that in terms of our ability to serve the customers that come seeking our assistance. But that is one way that in a almost unintentional way we're saving money. But each of the departments has been challenged to look at their budget and to begin to make immediate plans to make changes if we need to, effective July 1st or before. Councilman Miller pointed out on Monday that it's much easier to deal with a budget cut, if you can respond to it over time as opposed to all at once. And so we are very definitely looking at that. But we generally, I think this would be confirmed by the OBM folks, we generally underspend in the first half of the year and then sort of catch up in the second half of the year, in the county fiscal year. And so if we can stay in that underspending mode throughout the year, we'll be in a much better position to deal with the state cuts when they come to us on July 1st.
Go ahead and ask your
Because it's kind of related to that. Madam
follow-up and get the extra questions.
Madam Chair, to Rick Warner. Okay, with county moving toward the RFPs for future contracting practices, in your opinion, will this be an easy transformation from past practices? And have you made any moves in that direction with the departments under your leadership?
Madam President, to Councilwoman Conwell, many of our services right now are in fact subject of RFPs. So in fact the biggest class of contracts or services that haven't been subject in the past to RFPs are the ones that you've already seen at the Department of Children and Family Services. So as an example, the Department of Employment and Family Services probably runs 10 to 15 to 20 RFP processes every year. They have a terrific contracting unit that is really probably our expert contracting unit, and we're actually calling on, I talked to the manager of that department yesterday at Employment and Family Services to begin to get his assistance on working on the DCFS contracting process. But even at DCFS, we do RFP a number of services. So I think we do have to step up our game on the procurement process with respect to the particular contracts that came to you at the beginning of the year. And we've already constituted a work group that is beginning to look at that. I'm confident that we will come up with a good process. It will be challenging only because we haven't done it before, but in doing our research or our due diligence before we've started, we have found, as an example, that Franklin County has a very good model for using an RFP to procure residential and foster care services, and even some of our local providers who would be out-of-county providers, if you will, to Franklin County participate in that RFP, and they've told us that they think it's a good model for us to use. So I'm encouraged that we're not having to start from scratch, but we've got a lot of work ahead of us to get to the point where we can release an RFP in the next couple of months in sufficient time to be able to get recommendations to the county executive and then over to you so that we have services that continue to be in place. I know, at least to me, October 1st sounds like a long time away, but it's around the corner if you will, in county time in terms of getting out an RFP and scoring the responses and making responsible recommendations to the executive and to you.
All right, Mr. Miller and Mr. Brady.
Madam President, I'll defer to the chairman of the committee and go after Mr. Brady.
All right, Mr. Brady.
Thank you, Madam Chairman. Actually, I was deferring to because I've been in so many discussions with Mr. Warner. I wanted to make sure that other people have every opportunity in a relatively short amount of time to ask whatever questions they have. The only one issue that I just want to emphasize, even though we're all aware of it, is that only about 1 year from now, the Health and Human Service Levy will be on the ballot. And that is, in my opinion, sorry? 1 year from next Tuesday, I'm told by Dr. Spock. Sorry, just kidding.
Well, Dr. Seuss agrees with Dr. Spock. So,
I'd like you to briefly talk about how important that is, why it's important. Sure. We know, but I just want to keep it on top of everybody's minds because without it, all these other things we're discussing are moot.
Madam President, to Councilman Brady, you are correct that we have with the Health and Human Service levies, we have generally been advised by the research organizations that we've worked with that going in the primary of a given year is the best sort of voter demographic for us for the for the Health and Human Service levies. And actually, under Joe Gauntner's leadership in the executive office, we've already had one discussion with Matt Carroll, Ed Fitzgerald's chief of staff, to begin to talk about the process that we've used, at least in the past, to plan for the levies. The levy that is up next year is the bigger of our two levies, so it represents about $135 to $140 million of the actual 230 or 235 million that's collected. Because it'll be a presidential year, the primary will be in March, and so our recommendation from a staff perspective, and that's Mary Louise Madigan and I who have worked most closely from the staff perspective on the levies in terms of getting organized. Our recommendation is to the county executive that we begin to constitute a campaign, mostly in the way of fundraising, sometime this summer. As I think I've said in a previous appearance before council, we cannot use county resources, taxpayers' resources, to pay for the campaign itself, and so we raise money through the County Action Committee, which is our campaign committee, and that requires fundraising, and we have about $60,000 or $75,000 in the bank from the previous levy campaign, but we usually our campaigns are anywhere between $400,000 and $500,000 campaigns to be able to run a week or so of TV before the of TV advertisements before the election, and probably do mail. We just learned last year about running, as I'm sure you all did, in a new environment where early voting is such a significant piece of electioneering. And so last year we actually did less TV commercials at the end and more mail early in order to try to engage voters. So our planning for that, really should start this summer. I mean, in my heart of hearts, I'd love to have raised, 2/3 of the money that we need for the campaign by the end of this year. So that we enter January 1st knowing sort of where we stand and what kind of campaign we'll be able to put on. So there's sort of the tactical side of it, which I realize I'm focusing on, but also then the communications piece of it, and that is to engage the providers that we work with and the advocacy organizations early. I do have to say, though, we have gotten to the point, and I don't want it to sound like we don't put a lot of planning into it, because we do, but we've had really terrific support from organizations that we work with in the health and human services world. The civic community, the foundation community, the business community have stepped up regardless of all the issues, and you are well aware of all the issues that that the county was dealing with over the last few years. Every time we went to the civic or business or philanthropic community for support for the levy, they were there early and making significant contributions. My concern for next year is just that it's an early campaign, earlier than May, and so we should get organized in 2011 for 2012.
Mr. Miller and Mr. Greenspan.
Madam President, Mr. Warner, first, congratulations on your recommendation for appointment.
Thank you very much.
And my first question is to follow up on the line that my colleague, Ms. Conwell, pursued. Normally, when you face budget cuts, you hear two things: either you got to raise taxes or you got to cut services. But my preference is a third way, which is to find efficiencies to provide the same services or better services for less money. And you mentioned two things that we might be able to do, which is one is simply not to fill unfilled positions, and secondly, to increase the use of RFPs. And my question is what other ways do you see that are out there to enable us to provide the same or better services for less money?
Madam President, to Councilman Miller, I would also say, although it will be a long process, the regulatory relief kinds of issues that we talked about in terms of trying to get continued state support for easing some of the more old-fashioned ways of doing business. I mean, to the extent that we have the opportunity to use more electronic or telephone or mail-in kinds of processes. I mean, I think to some degree Joe Gauntner is in the best position almost in the state to make that argument because he's been so involved with that over his many years in the benefits world as the director of the accounting department here. I also think we're gonna need to look at lessening discretionary kinds of spending. We've ground a lot of that kind of spending out of the existing departmental budgets at this point. So things that we did 2 or 3 years ago because we had the resources to do it and because they were a good idea have largely gone away. And so I think the opportunity in the future is going to be more about trying to make decisions about what services are so uniquely tied to the mandates that we're required to provide that we can't do without that service. So I realize, Councilman Miller, that it's not a super detailed answer by any means, but I do think we're going to have to look at significantly scaling back our relationships with some community providers to do services that in good times you like to do because they work, but in a tough budget time you can't. So I think we've already cut back some of those. I think we've got to continue to do that. And ultimately what we may be required to do is to look at consolidation of county departments. And as you will note when in your review of the PFM materials, they suggest doing some of that. I think their suggestions have a lot of merit, and I think we need to examine that. I mean, we've had the ability to have departments that are specific in nature, targeted at a specific community concern or priority. Our ability to do that in the future may be much lessened.
Madam President.
Yes.
To Mr. Warner, I would suggest that one additional area might be in the area of IT spending, where there's a lot of money being spent and it's somewhat fragmented. My second question relates to the fact that when budget cutbacks are coming down the pike, the usual approach, as you alluded to, is to say, well, what are the things that we're mandated to provide, and we start with those, and then things that are not mandated tend to get cut. But the problem is that a lot of the non-mandated services that we're providing are things with a strong prevention focus, such as early childhood and reentry. And my question is how do we get ourselves through this budget tsunami that we're facing without the prevention services, which really hold out hope to improve the cost effectiveness of our human services programs being cut back or eliminated?
Madam President, to Councilman Miller, I agree with you and your analysis of the fact that it's prevention services that really do hold a lot of hope in terms of assisting families and individuals in Cuyahoga County. I mean, I will say, sort of by duct tape and chewing gum and good faith, we've been able to keep over the last couple of years as we've had to cut back. Still an investment in, as an example, reentry or universal pre-kindergarten through the early childhood program. And I do think in some respects we're going to have to choose among those. And when I say discretionary, I mean we may well have a local mandate, as an example. I mean a community mandate to deal with reentry issues, which I think is I consider to be almost as much of a mandate as those that we get from the state. But we may well be deciding that we have to step back for a year or two in certain things, try to keep a minimum amount of funding in to keep some level of the continuum of services alive. But I do fear if sort of the upper end of the budget cuts scenarios that we've talked about do come to fruition from the state, there probably are going to be some services that we are going to just have to say we're going to mothball. The good news may be, if you can take good news in that kind of environment, is that we do know how to provide some of these services. So in the event that things get slightly better a year or two from now, I think reviving some of those would not be as difficult as creating them in the first place. The other thing that I think is we've probably gotten better over time at providing new services more efficiently than when you first get them started. So I'm hoping with a modest investment, we might be able to keep some of those still alive. Councilman, if I can go back just to one issue that you raised in the first part of your question about the IT systems, I agree with you that's a major place where, as a county, we can look at savings and streamlining. The only thing that I will say that's a particular challenge for human services is that the big systems that our mandated agencies use are all, and I know I'm beating the horse even more dead, are all state mandated systems that we have no control over their structure, the way that they're organized, how they're used. It's SACWIS in the case of child welfare. It's the Chris E system in the benefits department. I forget the name of the child support SETS, the SETS system at child support. All those systems which cause our workers, sometimes no little amount of grief in dealing with, we can't change locally. And so that's another place where we need your assistance and advocacy in Columbus.
Madam President, to Mr. Warner, final question. I would like your comments about the transition recommendation that there should be a strategic planning process for human services as well as economic development, and whether anything like this has been done in the past and whether you believe that it should be done going forward.
Madam President, to Councilman Miller, when we did our transition planning process that involved the Human Services Department, and we worked very closely with the Center for Community Solutions, one of the recommendations that I think you saw in the materials was for a human services strategic plan. Until that point, or while I was the Deputy County Administrator, we didn't really have a county-wide health and human services strategic plan, because my view at the time was that each individual system, child welfare, the Adams Board, Metro Health, child support, you name it, all those agencies had their own strategic plans, and I really believed that the work of the Office of Health and Human Services that I work in was to try to assist all those organizations in implementing their strategic plans, and when necessary, trying to mediate the cross the issues where those strategic plans didn't make sense. But there was very strong feeling in the transition committee that we needed a community-wide, county-wide strategic plan. Joe Gauntner and Matt Carroll have started a discussion internally inside the county executive's office about how to approach that, and I'm fully supportive of moving forward with a strategic plan for human services. My only, I guess, caution is that I think we should wait till we really see what happens to us at the state budget, because then at least we'll have a 2-year picture of what our resources are, and I wouldn't want to make any recommendations to the executive or to you all right now, which might be completely upended by the state budget. Having said that, there's no reason that we shouldn't start a strategic planning process soon, or at least a strategic analysis of the direction that we want to take, because those processes take time, and obviously we will know very quickly what hand we're being dealt in the state budget.
Thank you.
Mr. Greenspan.
Thank you, Madam President. To Mr. Warner, a couple questions. I actually have 4, but I'll try to make them 3 or come back on round 2.
Okay.
No, do like Sean with the follow-up.
The follow-up. Okay, I'll try to coordinate one of these into a follow-up. I asked this question of all sitting directors, or in this case, a deputy director. You've been in office since in the position
right.
since late 2002.
Yes, sir.
What have you not been able to accomplish, and what do you want to accomplish that you have not been able to, and what is your vision? And I'd like you to be as specific as possible. You don't have to go through if there are 100 in your head. Don't go through all 100, but you've spoken very eloquently, but in very general terms. So I'd like to know specifically, what have you not been able to do, why, and what do you expect to do going forward?
I think what we have not been able to, Madam President, to Councilman Greenspan, I think what I haven't been able to do, or we collectively haven't been able to do, is probably a version of what Councilman Miller just asked about, which is to create an overall approach to the provision of social services in Cuyahoga County that takes into account that different systems with different mandates and oftentimes different governing organizations exist. And I think that we've done at a staff level as much as we can do to break down the barriers and silos that Councilman Gallagher and I chatted about a few minutes ago. I don't think that I think that oftentimes during our budgeting process, and this is obviously an opportunity that you all and the county executive will have, we didn't make hard decisions about using the county's funding to achieve specific results. I will say we did. In one case, I'll use an example where I think we did. The commissioners made the decision a couple of years ago that the continued maintenance of a separate alcohol and drug system and a separate mental health system was not in the best interest of the community from a funding standpoint or a service standpoint. And so the commissioners specifically said to those two systems, you must combine. And, we will use our funding leverage, and we provided probably about 20% of their overall combined budgets, but specifically we provided probably 100% of their discretionary budgets in terms of dollars with the most flexibility. We forced that kind of change. I think we're going to have to use our dollars in that way. Our recommendation, I guess, could be that we use our kind of dollars that way to force change within systems that don't seem to line up as well as they should with the new environment. There may be the opportunity to do that, Councilman, with respect to juvenile court. Right now we use the Health and Human Service levy to support some things in juvenile court. I don't think it's the desks and chairs and conference tables, but it's the kinds of services that they provide. I think we need
not the treadmill, the punching bag, or the elliptical.
No, not those either, to my knowledge. But I do think we've got to use it's not so much the bully pulpit as frankly the purse string of the county levy dollars to, and I don't want to use the word force, but to incentivize, I guess maybe would be the way to say it, more alignment of strategic goals. We are not going to be able to reach everybody's strategic goals or mission or system priorities in this environment. And so we have got to force more consolidation and more high-level agreement that there's maybe 3 or 4 kinds of issues that we could address. So I think if I have to admit to a failing, and I will admit to many over the last 6 or 7 years, one of the things that I think we were sometimes, the commissioners and the Human Services Department in particular, we were loath to use or reluctant to use the purse string to really try to force some needed efficiencies or consolidation of goals. I realize that's sort of a long answer, and it's still at the 50,000-foot level. But I do think as you look at the strategic priorities for many of these systems, when you get down below the 50,000-foot goal, you'll see a lot of commonalities. And so the issue is just we don't need 3 systems necessarily trying to provide the same service, a variation of which is just costly and duplicative in some respects. So I think we've got to figure out ways to look at that. The other thing that I think we will look at over time, and I think it will, it's something that we talked about at length and never did anything on, is trying to provide almost a countywide template for the provision and for the purchase of services. You've challenged that, as the county executive, to do that with respect to residential services. If that works well for us, there's no reason why we can't ask the juvenile court to participate with us. Then we won't have the kind of discrepancy, or we'll reduce the likelihood that there'll be the kind of discrepancies that we've talked about here a couple of times. So again, that's probably a version of using the county's resources in a way that incentivizes or maybe even forces, in the extreme example, compliance with countywide goals.
Okay, thank you. You actually touched on two of my other questions. One on I'll start with the third one first, actually the evaluation and scoring of service providers, which we heard testimony, which I think all of us were equally floored and disgusted by the scoring system that was in place. Not only the scoring system, but also the methodology in which the scoring was done basically by the same department.
Right.
Even though there were 2 different people in the same department, the overarching control over the system itself was one manager. What is your opinion about segregating that out to make the scoring number one more fair, and number two independent from the actual decision-making authority of having to ultimately choose between a provider that has been failing versus one that or has a failing score versus one that has had an average or above average score, because it appears that the scoring system is irrelevant to the service provider entering into a contract with the county.
Madam President, to Councilman Greenspan, I mean, you've raised a number of issues in that question. I think I would first say, with respect to that, to the evaluation document, that one-page or evaluation document, in the category of no good deed goes unpunished. We established that 3 or 4 years ago at the request, I think, at that time of Commissioner Jones, to try to give him an evaluative tool, but a brief one, of the kinds of levels of service provision that we got from providers. To your point, the problem with them, you can have very different sets of scores, even provided from the same department, because you have different scorers scoring them. And somebody's average is somebody else's above average or below average. So defining some kind of uniformity to that process, whatever you use, I think the council's general comments when they saw those, sort of highlight, frankly, our frustration with them to some degree. They're not useful. They're not truly useful tools to evaluate the work of providers. And that isn't to say that back at the departments there aren't much more detailed judgments based on site visits and performance outcome data analysis that are done. But then we boil them down onto this single page with 4 or 5 whatever categories for the level of service. So I think we've got to improve a lot on that. I think the county stat process that the County Executive Fitzgerald is putting into place will help us more from a framework perspective and looking at it from a new way. As to your question about the ability of the same department both to score, to put out an RFP and get proposals and then score them, I would agree with you that it's hard to build a Chinese wall between functions within a department. And as the departments get smaller, sometimes people are doing double duties even between divisions. I guess what I would do is partly reserve my answer in the sense that I think when we come back to you and to the administration with a recommendation of how we move forward on these new RFPs, I hope you will see more transparency put into the process and more involvement from outside folks. I mean, there's a limit to how far we can go outside, because if we go outside the county, we're probably asking people who have an interest potentially in one of the contracts to do that. I have mused over the years about the possibility of creating a pure contracting unit within Human Services. It doesn't work for any department, and in fact manages all those processes. That may be where we end up landing. I don't know that we'll get there in the first iteration of this RFP, but the kinds of issues you raise about potential bias, even if it's unintentional, and sort of favoritism, and perhaps not being as aggressive as we need to in our review, is something that we've got to look at. And I hope we can gain your confidence with the process that we're going to use this time on the DCFS contracts. But I would say you should also view that as a first draft or a down payment on what I hope we can do in the future.
Great, thank you. My last question, actually it's more of a statement than a question. You touched on, and Councilmember Miller touched on it as well when we talked Monday in Finance Committee meeting about the inevitable budget cuts that are coming. It troubled me a little bit, but I understand where you're coming from when you said that you've put forward and you presented 3 quote-unquote contingency plans. I would say the first one's not a contingency plan, the 10% level. It's going to happen. Depending what you're hearing out of Columbus, I think the $8 billion's low on the deficit. There's a $2.3 billion payback to the federal government for unemployment benefits. So right there, you're at almost 10.5. I'm hearing the number may be as high as 15 billion. So whether it's 10.5 to 15, 10% is probably conservative, not a contingency plan. The statement I think that Councilmember Miller was making, and that I'm trying to make here today, is start cutting today. It's coming. I made this, and I'll talk to, if I'm here this afternoon, to Mr. Danahan. I'll tell him the same thing I told him 3 months ago. The budgets, these cuts are coming. 10 may be too light, but we know it's at least 10. So if you're selected to continue in this service, start making those cuts immediately, like yesterday. Don't wait. It may be 20, but at least you're halfway there when you make them. And the savings you make today, let's say we're able to make 3 months worth of savings at 10% today, will help lessen the burden 3 months into the cut, which will be in July. So, and I'm going to make that same statement to whomever else comes before us from this point forward, because this is not a contingency. This is an inevitability. The last, that was a statement, so I have I converted my question into a statement.
But who's counting, right?
I did that craftily, and I actually will take credit for that. Because I am so modest. Are you currently classified or unclassified in your status with the county?
Madam President and Councilman Greenspan, I have been unclassified ever since I got the Deputy County Administrator role back in 2002, end of 2002, beginning of 2003.
Okay, great. I have no further questions.
If could I just respond a little bit though to your statement, because I do want to say one thing on the sort of the preparation. I think again we have begun the planning, which I realize is not the implementation, but I will say, and I think I'm correct in saying this, that almost every one of our departments last year underspent their 2010 budget. Some by a little, some by more than a little, and so I think the gospel that you're preaching, which is very important for us, I think to some degree, whether we did it intentionally or not, we've actually been already following, but we have to do it much more intentionally and much more seriously going forward. So I recognize that.
Thank you.
Mr. Jones?
Good morning.
Good morning, and congratulations.
Thank you very much.
Getting to this point. We have a new county government, and people are, I believe, excited and look forward to new things happening and outside of the box thinking. You talked about continuums of care. One in particular, the homeless. I've heard discussion about a new model with programs like Housing First, where we have in the past managed homelessness through shelters. And now a new model of almost an intuitive way of seeing one of their fundamental problems as being they don't have housing. So we give them housing and still have some degree of shelters as a front line. In this new model, do you, one, support this model? And do you support it? And how do you see in these budgetary cutting times this moving forward? Is it going to save money up front? Will it cost money up front? And if it's, as I've heard, could actually be a cure to homelessness as opposed to simply managing homelessness? Talk about that briefly.
Madam President, to Councilman Jones, to your point, the permanent supportive housing process that I talked about a little bit in my opening remarks its brand name is Housing First, which is to try to your point, to say that you don't necessarily have to have worked every one of the plans, whether it's behavioral health or substance abuse or a job and income to get housing, so that once we stabilize somebody with housing, lots of other good things can happen after that with the right amount of support and case management. So the county has, with a lot of partners, this was really started by Julie Rittenhouse at the Sisters of Charity Foundation 6 or 7 years ago, where she interested Commissioner Peter Lawson Jones in going to Chicago with a group of folks to look at a Housing First process and building in downtown Chicago. That has led to the establishment through lots of work from the Cleveland Housing organization, the Enterprise Foundation, a bunch of other, the City of Cleveland have come together to do the capital side of establishing those permanent supportive housing sites in many neighborhoods. I think we're up to 5 or 6 different freestanding permanent supportive housing sites. It is not inexpensive on the capital side, although those are one-time dollars, and those generally come through sources other than local the Health and Human Service dollars. So the initial cost from the Human Services standpoint is relatively low, and in fact, actually, as the folks that we serve move out of the emergency shelters, and in fact, we've seen a decrease in the number of individuals that we've served in the emergency shelter system, and the families and the women and families that we serve at the women's shelter. The challenge is going to be going forward. Right now, we have been able to divert funding and some federal funding, one-time or short-term federal funding, into the package of services that are necessary to fund, or the funding necessary for the services or the package of services that are necessary at these permanent supportive housing sites. So the challenge in the short term, we are adequately funded. I don't want to say well funded. The challenge is going to be as more and more folks move from the emergency shelters, which is an expensive way to serve people and frankly maintains their homelessness, as we move them into permanent supportive housing. We have to make provision for using resources to provide for the ongoing case management. Ruth Gillette and her office have been very creative in using existing dollars that we get from the Federal Department of Housing and Urban Development to do that. And so far, we've been able to keep up with the number of individuals or families who've moved into permanent supportive housing. We're going to need to, and we've been able to do that a little bit with some stimulus dollars, which are going to go away in another year or so. So we do have to look to local sources. I will say we've had tremendous support, more in the nature of just spoken support, rhetorical support, as opposed to investment from a lot of the Greater Cleveland philanthropic community, and I think we have to look at them to assist us in providing for the ongoing operational support for some of these sites going forward. And we have started those conversations, and we would welcome the assistance and sort of the bully pulpit opportunities that the council might have to help the philanthropic organizations see the value of investing with us in this funding partnership.
We've already discussed the prevention, the importance of prevention, the negative outcomes that are just so costly when you don't focus on prevention. Are those well documented? The negative outcomes. We see the expenses on the justice side of our county budget. A child that's unadopted, the preventative costs of helping them early on, but the negative outcome costs if they turn 18 and are leave out the doors with no family connection. Are those dollars ever documented? I haven't seen those type of numbers to weigh, because everyone will want to cut a preventative cost, but they don't. Sometimes I'm not seeing yet that overall picture of the preventative and the negative outcome dollars put together and said, well, let's save money by focusing on preventative costs. Are those numbers? Do those numbers exist?
Madam President, to Councilman Jones, certainly the numbers exist for the costs of providing service to deep end kids, whether that's in juvenile justice or child welfare, and the relative economy or lower costs of providing prevention services, I think, is fairly well documented, and we can certainly share the information that we have. I don't know, though, that always the connection's made between investing early to prevent those kinds of costs. And I think what happens sometimes in the calculus that systems are making about what dollars they can, or what services they begin to cut, we begin to think we can cut prevention dollars or prevention services, and somebody else's system will pay if there's a negative outcome. So if we don't do some of the early intervention services through our Invest in Children program, and a kid's emotional or behavioral health needs are not addressed when they're very young, when those problems mostly manifest themselves, it may well be a school system that has to, if you will, pay the price for that lack of early intervention, or the child welfare system, one of our systems, may well have to pay the price. So I think there needs to be better connection between the investment on the prevention side and the avoidance of costs on the deep end side. The challenge, though, in a shrinking budget time is, people will be saying, well, I'm not sure that this would be their public statement, and it certainly wouldn't be mine. Well, that's somebody else's. That'll be, if something bad happens, that'll be on somebody else's tab, and I don't think that's the appropriate approach to take. But I do think we have to connect up those early intervention services with the avoidances of cost, and specifically make that connection, and try to. And this goes back perhaps to Councilman Miller's question about a strategic plan. If we have an overall strategic plan which says these are the priorities that we want to address, then trying to connect up prevention services that address those priorities to avoid deeper end costs to us, longer term costs to us, maybe we can make that connection better.
Like to save my last question.
Go ahead. I don't think anybody else has any other questions. Oh, I'm sorry. Go ahead, Mr. Rogers.
Thank you, Madam President. Mr. Warner,
Yes, sir.
congratulations.
Thank you very much.
I had one question that's somewhat of a comment, and I guess you can respond to it if you'd like. But regarding the placement of children outside of Cuyahoga County or outside of the state, I would imagine that on some occasions that it's in the best interest of the child to take them out of the county or out of the state because of safety issues or the environment that they're facing within the county, that they may be at risk if they stay in the county, and that we may want to remove them from family members or other people that are in the county that then may want to harm them. I'm not sure if that's...
Madam President, to Councilman Rogers, I think many of even our local providers, if we are actually committing a child to residential treatment, they would be taken out of the specific harm's way, if you will, if that's sort of the context that you're thinking of. Usually, I believe, and I can get back to you with more specific information, the need to send a child out of county is made more on the specific programmatic or the behavioral needs that require a program that we can't get locally, because we do have the ability to separate a child from a very bad situation even if we're using a local provider, and so the issue probably is more to the needs of that particular child that would require us to send them outside of Cuyahoga County. And as we've talked about it, I think at previous meetings, the cost is more than just the per diem that we pay to the provider if we send a kid to Texas or Pennsylvania. It's also sending our social worker there for regular visits. It's the cost to the family if the family can engage with the child, that they have to travel farther or can't travel and are therefore not able to see the child. So I think our foremost interest is the safety and the security of the child. So we're going to make sure wherever we send them, local or out of state or out of county, it's a safe environment for them.
Great, thank you. Some time ago, I was in a meeting with a group of people, and I can't for the life of me think of who they were or what company they represented, but they indicated that they had created some software that's proprietary to Cuyahoga County, and it was a case management type software that the county had purchased, and it was intended to be used with iPads that my colleague over here has, where social workers can take the iPad out in the field. The iPad has we call the GPS monitoring in there, so you can indicate, so you know whether or not a social worker had actually visited a home, and then they can keep all their records electronically. Is this something that's true, or is this something that the county is looking at doing? Or
Madam President, to Councilman Rogers, there's very few things that probably aren't true because we're sort of a big. I won't put the Y at the end, but we are a big octopus sometimes. I think that I believe what you may be referring to is for our home health care workers in the Department of Senior and Adult Services, we have set up an electronic system for them to, I don't think they carry an iPad. I think it's more in like a BlackBerry, I believe, kind of thing where maybe it's a laptop with an air card, where they can, when they visit a home to assist a senior who they provide with sort of personal services, they have the ability to, say, I arrived at 10:42, I did laundry, I fixed lunch, and I left at 11:45, and I'm on my way to my next one, and they can type up their case notes. We have tried. I'm not aware of a department yet that uses iPads, but we have attempted to use laptops again with connectivity to the internet to provide off-site services. There are some that we just can't. One of the challenges that I know Joe Garner used to get when he ran Employment and Family Services was folks who were saying, well, rather than having 5 or 6 centralized offices. Why don't you have, neighborhood sites where you have 2 or 3 workers and a couple of computers to make it more convenient for the folks that we serve? And it's a terrific idea, but the problem for us is, again, because of the amount of services that we're required to have at any place that we call one of our offices, it's very difficult to do that except for in rather concentrated sites with lots of staff and lots of resources. But I think we are trying that. I believe that's in the Department of Senior and Adult Services. The other thing that we do in that department is there's a program called Benefits Checkup, which is the we have both staff as well as community partners who work with us to go to community centers, senior centers, and with a laptop there, again, talk to a senior and try to find out if they're taking part in all the programs that they're eligible for. But I think the specific thing you may refer to might be the home health care aides. And we have any number, though, of local case management software systems that we work with in each of the departments.
Do you see a program like that's being used in the senior?
I think it's been a terrific management tool, and convenient for the home health care aides too, because they're not having to write down. I mean, I think there are program codes for the kinds of services they do, so they're not having to do as much. It has saved them time, and it's also been an ability for us to track their progress, so we can make sure that we're deploying them most efficiently, because these are folks who are literally going out into all parts of the county providing service. So it has been an effective management tool, and I think an effective tool for the home health care aides themselves.
Right. And Madam President, this is a follow-up to that. Well, do you see this as this type of program as something that can be replicated throughout other departments, particularly ones that deal with having to visit homes and talk to children?
Madam President, to Councilman Rogers, I do think, I would love to see the social workers, either on the child welfare side or on the adult protective service side, have more of those kinds of opportunities to use technology to assist them in what they're in what they're doing. Exactly how to do that, I think, requires each department to look carefully at all of their processes to try to determine where best we can use technology. And I'm hoping as a new IT director comes into the county, one of the things that we can talk with him or her about is, what are some innovative uses within human services that we can sort of road test here. I mean, I think, we're a big enough operation that it might be an interesting place to try some new thoughtful approaches to using technology more effectively in the field. I think we use it as effectively as we can within our offices, but it adds an entire new set of tools to the toolkit if a social worker can go out with a laptop or an iPad or something like that to assist them in the services that they provide.
Madam President, I have one more question.
We're running into some time restraints because we have a meeting at 1. I think Mr. Werner has an engagement. What time do you have to be out here? Yesterday.
I'm chaperoning one of my daughter's field trips to the Cleveland Public Library, so it's not till 1 o'clock.
Okay, but we also have to get people to get lunch, and so if you could be quick, and I know Ms. Simon has a question, Mr. Germana. So,
sure, I'll be very quick. The transition. Cuyahoga County Transition Group on the Health and Human Services side had a lot of talk during the campaign season regarding a no wrong door policy, and I'm wondering your thoughts on that, and have you adopted that as the director?
Madam President, to Councilman Rogers, no wrong door has been a sort of a mantra of human services at the county for quite a long time. It was, I think, initially came up through the county's Family and Children First Council process, and it was a thought that no matter what system you entered into, whether juvenile justice, child welfare, public assistance, child support, that if you needed services that department couldn't provide, they could do an easy handoff to you, or at least a suggestion to you and your family of where you might go get those services. The image I've always had in my head from being an old Beatles fan is in the one Hard Day's Night when they all walk into different townhouses with front doors. When they get inside the door, they're all in one big room. I'm dating myself, I realize. And I think we've tried to establish that kind of approach. It gets more challenging when the resources are less, and a lot of it involves cross-training of staff, so that benefit staff at Employment and Family Services knows the kind of services. I mean, obviously, if somebody comes into our our benefits office and says, you know, I can't take care of my child and I'm neglecting my child, we're going to do an immediate handoff to the Department of Children and Family Services. But it's more the preventive and the extra kinds of services that we can provide, sort of the extra assistance, that I think we have to make sure that we train our staff as well as we can about what the other systems offer, so that there is no wrong door. The challenge, though, in this environment is, you know, every time we do, it's very challenging to stay up with the regular training that we're required to do for our staffs to do their day jobs, if you will, or their regular jobs. If we pull them off, as it were, the floor to do another day of training on what the other systems do, we get even further behind on our provision of service. So it's a logistical challenge for us now. But having said that, it's a very good approach, and it's one that I hope we don't lose in the budget cutting that's to come. Thank you very much.
Ms. Simon?
Madam President, thank you very much. Congratulations.
Thank you very much.
I just have a quick question. I know time is running. My clients in my law practice are often clients of the county. Their kids are in the system, they're obligors, they're obligees.
Right.
And one problem that I've seen over the years is the callback time, trying to get any place in the system. For example, I, in fact, was a client. I told Mr. Guntner on Monday I called Child Support Enforcement Services because my client's wages are being garnished, I believe, in excess. Today's Thursday. I haven't been to my office yet, but so far I have not received a call back from a caseworker. So this is the experience of my clients and even of me. Oh. And what is the remedy? I mean, I know there's been the Office of Ombudsman, perhaps, that's been maybe sheriffing the services, but is there a different way or a better way that you see that these clients can be served more effectively?
Madam President and Councilwoman Simon, I mean, the experience that you have, I regret, but I don't think it's necessarily isolated. I know that from a management perspective, many of the human service organizations, county human service agencies, have set up voicemail systems with prompts to not only remind a caseworker or a social worker or a support officer that their voicemail is full. It also sends a reminder to their supervisor that they have unanswered calls or that their voicemails are full. So I think we have tried internally and counseled not only our staff to be responsive as much as they can be under the circumstances, but also include that in the supervisor's duties to make sure that they're following up with their staff. But there is nothing like, and I'm sure you know this as an attorney, there's nothing like following up and going one step up if you don't get service. I'm not saying that that's a good model to use, but I do think sometimes particularly our longer-term clients are very adept at knowing, that if you don't get a call back in a day or two, if Mr. Smith doesn't call you back, then you call Ms. Jones, his supervisor. So I think there's there's more sophistication sometimes in our clients than we sometimes give them credit for. But having said that, it's not our goal not to return people's phone calls. And I think one of the things that we have to do is try to use technology as much as we can, and the way that that the caseworkers' days are set up and the priorities that the management puts on them to give them the opportunity to be more customer responsive. It's a challenge these days, partially because of the staff issues. I mean, there are many caseworkers in each department that have seen their number of cases that they're servicing go up exponentially. And these days, when we're not able to replace a worker and somebody leaves, then we've got another, in CISA's case, 1,500 cases that have to be reshuffled among the existing support officers who are left in order to make sure that every case is covered. So I'm not trying to excuse the poor performance in that regard, but I think it may require more advocacy on behalf of either representatives of our clients or the clients themselves sometimes to get attention.
Madam President, just a fast follow-up question. There's no doubt that I know how to navigate the system, and I could have probably gotten an answer on Monday, but I wanted to be a regular customer just to see how long it's going to... Right? But the question is, for my clients who have to do this on their own maybe, or I would like to see, in this maybe a different discussion, some way that they can get a response within 48 hours or someone they can contact. Sure. And I don't know if it is that office of that I'm not sure what
ombudsman.
they're doing over there, but that's all. I'm going to put that out there. That for clients who can't afford an attorney, or you know, I'll let you know when they get back to me. I understand they're overworked, but I hope there's some remedy for people who can't afford representation.
Madam President, to Councilwoman Simon, your point's very well taken. I do think we have to figure out a way to address it. It shouldn't be just folks who are in a position to have an advocate for them who get the kind of service they deserve, and we shouldn't be forcing people to call the ombudsman's or anybody else's office. So I hear what you're saying, and we'll be happy to work with you on trying to figure out ways to address that kind of issue.
All right, Mr. Germana and then Mr. Jones has pleaded for one quick question and Mr. Brady for a wrap-up. Okay? All in 6 minutes.
Well, thank you, Madam Chair. To Mr. Werner, and actually to my fellow council people, you folks, every confirmation hearing, I'm impressed by the quality of the questions. So we don't have much time. I'm just going to make some statements. Sure. Number one, we are change. We're probably, the highlight of counties. Everybody's looking at Cuyahoga County. So as far as the streamlined services, cutting red tape, ease of doing business, state mandated systems that need to be changed, we'll do this. We'll do this. If you get specifics, we'll go down because, it seems like these county commissioners systems throughout the state, it's don't rock the boat, don't rock the boat. We're the rock and roll capital of the world here. And rocking the boat really is not a problem. If we need change, I'm finding out and talking to all my people, they're expecting change. They're loving change. They want improvements, and we'll carry the water because we're planning to go. A lot of these things are so interrelated with the finances and the cuts and so on and so forth. What we see, whether you're philosophically agreed or not, it seems like we have a governor and legislature that's willing to change some things, and if we could be the catalyst to get things improved for the whole state, we'll do that.
Thank you.
Secondly, this idea of different agencies don't want to do this. They're passing off the tough ones. And I'm guessing, and I'd be very interested in seeing numbers of how many real troubled cases we have. And I'm just guessing that we probably have more than any other county. And we're renowned. We're the medical center of the United States. And you know what? If we could somehow be incubator for having a system of having the greatest child care from the worst case, think of Cleveland, Cuyahoga County, maybe even a small section of that medical mart, in saying that this is the destination. We take care of our children, the toughest cases. Send your people here. And I don't know if we could do this as an incubator incentive. What we need and what kind of care we need. And maybe we could find somebody that maybe if the county even gave incentives where we could start that and be, at the best in the country, right here in Cuyahoga County. And let me just tell you, I'm very impressed with your background. Your answers to these questions have been very thorough. So, congratulations.
Thank you very much, Councilman.
All right, Mr. Jones.
Mr. Werner, I'd like to follow up with the question my colleague, Councilman Rogers, asked about the no wrongdoer policy. You mentioned there were IT solutions, cross-training, computers, things like that. I talked with a county employee, 30 years of experience, worked across several points of entry for the county, and this person had a low-tech solution of, I just made a manual. I've worked in so many. When someone came in with multiple issues, I give to my successor a little homemade manual and said, you can refer them to there. Do you see that as an inexpensive initial step towards actually securing this no wrongdoor policy?
Madam President, to Councilman Jones, absolutely. I mean, I have a feeling that the experience that you had with that one caseworker is replicated across the county. I mean, we've been lucky to have long-term employees who have really gotten to know not only their own system but also many others, and I'm sure that each of them has a cheat sheet, if that's the way to think about it, of numbers that they can call and people that they can call on other systems where they can get a quick answer to something. So I like the idea of using sort of low-tech solution. I mean, I like the suggestion of looking at it from a low-tech perspective, and I think there's ways that we can try to find examples of that folks can share. So I think it's a terrific idea, and I'll do some follow-up with it. If you want to give me the name of offline of the person you talked to, I'd be happy to follow up with him or her too. If they haven't copyrighted their cheat sheet yet.
All right.
Mr. Brady.
Thank you, Madam Chairman, and thank you, Mr. Warner, for your 2 hours of testimony. There are only 5 of us on the Health and Human Services Committee, and it's very obvious that in a lot of ways this is a committee of the whole. Every member of council has an intense interest in Health and Human Services, and it is such a large part of the budget and means so much to our community. So I just want to reiterate what's obvious, and that's that please keep track of our schedule every 1 o'clock and maybe every Thursday, the way things are looking. We'll be here. You'll have lots of opportunities to have discussions with Mr. Warner where we can really drill down and have the time to discuss a lot of these issues. My Vice Chairman Yvonne Conwell and I are still determining how to divide responsibilities because there's so much to do here. But I know many of you have an interest in this. In 1 hour, we'll start all over again with part of it. There's a couple of board positions coming up with Metro, and there will be board positions coming up with the Adams Board. I would, hope that everybody would want to participate. The fact that Councilman Miller held a Finance Committee meeting already on Health and Human Services is another example of how we all need to be involved in this very important part of county government. And we've already held a joint committee with the Safety Committee to explore possibilities of how we can work more closely with Metro and the jail system. So we've got a lot to do, a lot of work to do, and certainly it's going to take all 11 people to some extent to focus on this very important area. I would like to move Mr. Warner's nomination to the council for consideration as the Director of Health and Human Services, and I make that motion.
Second. All right, moved by Mr. Brady, seconded by Mr. Miller. Is there any discussion? All right, call the roll.
Mr. Miller?
Yes.
Mr. Brady?
Yes.
Mr. Germana?
Yes.
Mr. Gallagher?
Yes.
Mr. Schron? Schron is not present at this time. Ms. Conwell?
Yes.
Mr. Jones?
Yes.
Ms. Conley? Yes. Mr. Rogers? Ms. Simon?
Yes.
Mr. Greenspan?
Yes.
Motion carries.
All right, motion carries. We will see you hopefully on Tuesday, the 8th, at our regular meeting for confirmation.
Madam President, I would just want to say thank you, and I would be remiss if I didn't thank Janet Carr, Mary Louise Madigan, Joe Gauntner, and Bob Ivory, who helped me put together the presentation today. So I very much appreciate the vote of confidence, and I look forward to working with you if I'm confirmed next Tuesday. Thank you.
Thank you. Is there a motion to adjourn?
Moved.
All right, all in favor, say aye.
Aye.
All right.
Yeah, I think you